Welcome to the Heart of Healthcare podcast. Hello, listeners, and welcome back to the show. I'm your co-host, Halle Tecco. I'm here with Steve Kraus, and this is our monthly digital health download where we share the stories that we think were most interesting or most important for our industry. Steve, hi, happy June.
I know, I haven't seen you.
H1, yeah.
I haven't seen you in forever because you did your very successful book tour. Congratulations on that. But
Thank you.
It's great to spend at least an hour with you, my friend.
Yeah. And as always, there were more stories than we can actually share in the next hour. But we will note for our listeners that this month, we actually have a little bit more diversity in the stories that we're sharing. So we're bouncing around a lot, but I think that they're all super important. So, yeah. Steve, do you want to take the first story?
I will. I read two stories this month, which were interesting, what I'd call kind of canaries in the coal mine for our industry. The first story was a Wall Street Journal article that noted, it was titled, "Forget Tech and Forget Hollywood. California is powered by healthcare jobs." And the fact that healthcare jobs are basically not just for California, but for the U.S. economy, propping up the market, the labor market, and that without healthcare hiring, the state of California would have actually net lost jobs over the past 4 years. But there was a study by the Economic Innovation Group that analyzed labor data from March 22 to March 2026 and found that health and social assistance jobs in California grew 25% over that period. And if you strip those out, even in the home state of Silicon Valley and Hollywood, what you'd find would be a net job decline, the widest gap of any major state in the country. So that plus the fact that across the country, healthcare accounted for roughly 47% of April's better than expected jobs report. And our economy that we live and operate in and invest in and build companies every day is driving the U.S. economy. I thought that was really interesting, Halle.
Yeah.
And then
And Steve, just to dive in a little bit there, what kind of roles are these? Because we know that they're not all clinicians. There are 1 million physicians in the U.S. So these are nurses. These are
good question.
Health aides.
The interesting thing, most of these jobs are actually low wage. So these are, or what's considered lower wage. The fastest growing categories were home health aides, senior care workers, and mental health practitioners, which probably isn't a surprise. Roles where real wages have actually declined in real dollar terms. So, but, very important part of the economy, right?
Sure.
And so that was interesting to me. A lot of those jobs, if you think about who's paying for those jobs, which payer in the health insurance world is paying for those are Medicaid mostly jobs, right?
Yeah,
Medi-Cal, exactly, in California. And so very interesting if you layer on top, we think about the federal government attacking Medi-Cal recently and saying there's a bunch of fraud and actually stripping away lots of dollars from the California Medi-Cal data. You think about the One Big Beautiful Bill, right, and the impact it's going to have on Medicaid. And frankly, then you think about AI. I mean, I guess we'll talk about AI a little bit now and what impact it'll have on labor jobs. We're really not talking about that, and we should as a society and a country. It leads to the second story I saw, which is probably the biggest canary in the coal mine, that basically last month, Chapter 11 filings for healthcare providers rose 33% in Q1 of 2026. And the article noted that,
wild.
The impact of the One Big Beautiful Bill hasn't really been even felt yet. Like, I know this from my companies that invest in Medicaid, is they're all thinking about what happens in 2027, because that's when the things like provider rate cuts, work requirements, eligibility redeterminations actually kick in that will lead to churning of millions of people off Medicaid coverage. So that impact hasn't even been felt yet, and yet healthcare Chapter 11 bankruptcy filings are up. We know the impact of ACA and the lack of individual subsidies there have had an impact on insurance companies. We've seen that in the news stories, and obviously led to less members using ACA, which tends to be lower income members, right, Halle? Those are folks who necessarily aren't on the Medicaid line. And we've seen the impact that that's had on value-based care providers who deal in those markets. So it feels like a very dichotomous, set of news stories this month, but one that has me worried. I'm curious what your reaction was.
It certainly feels contradictory that this is the fastest growing part of the job force in California, but then also all these providers are closing. So what that means to me is probably more consolidation, where those providers will then go work for larger and larger, oftentimes health plan owned providers that are able to manage their costs in different ways since they're part of this vertical chain. But as you were talking, I was thinking about how interesting it is for California, which is one of the most progressive, along with Massachusetts, states for Medicaid and believing in this safety net and probably has the best healthcare in the country, Massachusetts and California. I never really thought about it as also a way to prop up the economy. And what these Medicaid dollars are going to not just taking care of low-income and disabled individuals, but also providing jobs for low-wage workers.
If you're sitting as an economic advisor to the administration right now, generally Republicans are viewed as economy-friendly, business-friendly party, whether that's true or not statistically. That's the way they're perceived. And yet they're sort of, on the one hand, really making policies that hurt the biggest propeller of job creation, which we just talked is healthcare on the one hand. And then AI, which we won't spend a ton of time. We have one story on that this week. Eric Larson hit it. The impact that that's going to have on all industries, but in particular healthcare, again, which is the largest propeller of the U.S. economy. It's scary. It's scary. We need to be talking about this at the policy level. Last question for you. I know you have a bunch of companies that focus on the Medicaid population and trying to help that population provide better care, provide better access. I'm just so curious how they're going to navigate these storms.
It's tragic because it's such an important part of the market to serve. These are traditionally an underserved population. And so when we think about innovation, they're usually the last ones to see anything. And so seeing companies like Aikido and City Block that are really focused on low-income populations, you really want them to succeed because you know that population deserves better healthcare.
This is not a one-time story. This is going to play out over a number of years.
Yeah. And our show is almost 5 years old. So we will be talking about this we've been talking about it for 5 years. We'll continue to talk about it for the next 5. All right. So next story, let's talk about what's happening in wearables, because this market was truly completely written off about 10 years ago. I feel like investors wanted nothing to do with hardware 10 years ago, but now it is proving to be one of the more durable areas in digital health. We had so many headlines last month in this space. So first off, Whoop, they own really the performance optimization crowd in the wearables market. They just raised $575 million on a $10.1 billion valuation. Last year, they grew 103% year over year and ended the year cash flow positive. And we know that these, including Oura, they have both the hardware revenue and then also the subscription revenue, which was something like 10 years ago, I think we hadn't really gotten comfortable with as consumers. And now consumers are kind of used to paying a monthly fee. So these companies are benefiting greatly from that. And then they're also incentivized to continue to provide value, right? They're not just trying to get you to buy this product one time and hope you continue to wear it. They need to make sure that there are insights that are valuable for you, valuable enough that you're paying month over month for the subscription. So I think that's nice that it aligns their product incentives with their revenue model. So, of course, we also have Oura, and we had Tom Hale, the CEO, on this podcast. I'd love to get the Whoop CEO on this podcast as well. If anyone listening knows him, tell him we want him on the show. But Oura, they really own the passive wellness, sleep, women's health, and increasingly the longevity market. They also made over $1 billion last year, and they just filed to go public, one of the first ones to go public this year, if it happens this year. And then the other big story is Google. And Google bought the OG step tracker Fitbit in 2021 for a little over $2 billion. And now they really appear to be repositioning Fitbit as more of a mass market product with this AI health platform. They announced a $99 Fitbit Air, which is great introductory price for folks. And then they're taking the Fitbit app and they're renaming it Google Health. And it has a Google Health Coach with built-in Gemini. But when I looked at the Google Health app, it actually looks a lot like Apple's Health app. And we know that WWDC is next week. I'd be surprised if they didn't announce something in this space to kind of keep up with the Joneses. But so much going on in this space. These companies, they're building real businesses with real retention. They're each finding like an interesting niche that's big enough. The space is big enough for multiple winners. And increasingly, the value is less about the hardware itself and more about the data and the insights layer on top. So it's helpful, to track your metrics like sleep and steps, but it's even better to get insights of your patterns, suggestions for improving your health. And then I actually really love the predictions. That to me is like something that is helpful for me in my life to better understand my wellness. Steve, I'm a fan of the space. I wear the Oura ring. We talk about it every few months, but you still don't wear any wearables at all. So I am curious, what would it take for you to get one?
Well, Halle, our listeners, they can now see us on video, not just hear our voices. And so we're roughly the same age. I won't give away our ages, but like you clearly look better than I do. So you're doing better on your wellness than I am. That's for sure. I got a lot of gray hair and wrinkles. So I totally agree with you that I underappreciated what these companies would become, very honestly. So my bad. I make a lot of those bads. But I do think for a long time, there were a couple things. By the way, I think the tailwinds are totally now in the right direction of these companies, right? Originally, the form factors were rough. The battery life was low. Like these things were all solvable, but not with, it took a lot of capital and still does, right, for these companies to scale. But, that's one thing. And now they're actually beautiful. Like I see people wearing Oura rings and they actually look stylish. Like they're good looking. Like form factors have gotten a lot better. And Whoop has a really interesting sort of battery. The way it's constructed is that the battery is very small. So these things improve over time. The other thing that's improved, to your point, is the analytics. And that's only going to get better with AI. And batteries coupled with now AI, the improvements that those have made it now that I think for like a lay person like me, I'll say, who hasn't been an adopter, it's both. It looks good, it's wearable, and also I think the data that you get from it is truly insightful. Whereas before, I always felt like the insights were just, we had Zeke Emanuel on our podcast, right? And his book was called Eat Your Ice Cream. That's been one of my things about the space is beforehand, it was like, guys, we kind of know what you should do with your life in order to try to maximize your lifespan. These are not mind-blowing discoveries, right? You just don't do bad things, exercise, try to sleep well. But now with the predictive nature of the AI that's behind these things, it's actually, to your point, it's telling you what you should think about, not just what happened. Yeah. It's more proactive than reactive. And I think that makes it much more interesting to folks. And on top of that, we now have consumers involved in their healthcare, which frankly didn't exist before. I will point to the ACA as being one of the reasons that happened. I think there's other reasons, obviously. We just have a much more technology native user base nowadays in healthcare. So it's exciting.
You're going to get one soon.
I know. I keep saying I'm going to get one. I'm just like, I don't know, Halle.
Maybe the Fitbit one. It's only $99.
It's not. Yeah.
I don't even think they have a subscription fee or something quite low in the Google Health app. So
I think that
feels like an entry level one.
I mean, I know you love your family, but I think that might make you really happy if you saw me show up with like wearables on one of these podcasts. You'd be like, I converted Steve.
We would pause and take a moment to applaud.
I'm wearing an old school watch.
Excited. Yeah.
Exactly. All right, Halle. Enough making fun of me. Now let's go to. But this links to our next story a little bit. And actually, I think one of the opportunities for these technologies is both to engage consumers in their health, right? And ultimately, you can think about them being really interesting in a value-based care model, because one of the challenges in value-based care is you actually need the patient or the consumer to be engaged in their health outside the four walls of the hospital to drive down costs. But the other government program we're going to talk about, which is somewhat related, is CMS's access model. We actually had Chris Klomp on the podcast. We talked about this a little bit. It hadn't yet been released, but now it's live in the wild. The access stands for Advancing Chronic Care with Effectable, Scalable Solutions. And honestly, this program has a lot of potential. A lot of people are really hopeful about the impact it can make, but it kind of had an awkward coming out party. And so let me get into that a little bit. The setup is, CMS announced this program. Essentially what it's trying to do is create a new payment model that they hope will be deflationary, right, that encourages providers and digital health companies to partner in, it could be wearables, it could be other types of technologies, in a new 10-year payment experiment that lets them earn recurring reimbursement for managing Medicare beneficiaries' chronic conditions, things like diabetes, hypertension, chronic kidney disease, anxiety, depression. Those are the initial conditions. And, CMS has selected organizations. They announced 150 providers and digital health companies that were selected to participate in this program, to actually receive those recurring payments for using technologies to improve health outcomes. And the majority of these organizations had not previously served Medicare beneficiaries at all. So it's a new model that rewards the use of technology and does so through the Medicare payment chassis. So that's cool. That's really cool. And the challenge, and I think that's a big deal, right? Because it's the first time that the federal government has created a dedicated reimbursement pathway for digital health companies to operate inside the fee-for-service Medicare at scale.
And inclusive of startups.
Oh, lots of startups. Yeah, we had, names like you just mentioned, Whoop, right? Withings, Aledade, Guide Health, Noom. Obviously, big companies like Verily are participating. Major health plans, Humana, United, Cigna, CVS, and Centene pledged to line their own payments, which is cool. So Medicare set up a model, and then the major health plans followed, which often happens, to align their own payments to the same model framework by the year 2028. So that sounds awesome, right? Way for digital health companies to operate Medicare.
Yeah.
There's a but. There's always a but in our stories, Halle. The but here is that, honestly, a lot of companies, and I'll talk about two that are prominent publicly traded companies, but a lot of companies I know decided not to participate. Honestly, I think the reason is because the payments are low. They feel like this is the weird thing about healthcare. These organizations are caught at, like, I'm not a tennis player, but like at center court. You never want to be at the midline in tennis, right? Because the truth is, that.
You got to find analogies that are non-sports related.
You wear wearables, but you don't know. Yeah. We were talking about not being a baseball dad, but I think the issue is the Medicare fee-for-service payments that you get as a digital health company are actually higher currently than what you'd get as an access participant. So, that's, again, we talked about these thinly resourced venture-backed companies. I think some have been, they like the model, but they feel like the payments are too low. Now, Klomp and others would say, yeah, we set them too low because we want, AI to be deflationary. And Eric Larson and I talked, as we said again last week, about how so far AI has been inflationary. So anyways, the two most prominent companies that have opted out as of now are both Amada Health and Hinge Health. This is all public information, but they basically, Hinge Health CEO Dan Perez was pretty direct about why. He said, quote, "It will not improve outcomes, it will not improve the experience, and it most certainly will not reduce cost. Moreover, it's structured in such a way as to necessitate the removal of any clinical oversight, putting one of the most vulnerable patient populations, Medicare patients, at risk." He just sort of noted that the model really incents providers and digital health companies to kind of pull the labor out of the delivery offering. And
for a population that is most skeptical of AI.
Yeah. So it's very interesting. I'm a big fan of Access and what it's trying to do. And yet it would be a shame if a lot of companies didn't participate. One, because of and Dan raises a really legitimate concern. Like, this is a concern that I think if you look at the general population, AI is polling very, very low in terms of, political polling, like maybe even lower than Donald Trump's approval ratings, right? Is like people are very skeptical of AI across the entire economy, right? Yep. Because it's threatening jobs, but also in healthcare, like I think people really are concerned, is like AI going to deliver as good of care as my doctor?
I know. It's such an experiment because generally the first population is going to be the early adopters. And it's going to be folks, it's just like the wearables. As you were saying, the wearables weren't great 10 years ago, but they didn't have a ton of insights. They were clunky. You had to charge them every night. But you had those early adopters that were still super enthusiastic, and they funded the innovation that got us where we are today, where we have $99 options, and will continue to only improve. It's really interesting. I mean, you don't see this in the market naturally. Right? This is not something that would have occurred otherwise, to start with the Medicare population. So elderly people who are most skeptical of technology and certainly of AI, and give them tools that they might be wary to use. So we'll see what happens. I think a question for you on Daniel Perez. I appreciate him being really honest about it, especially, it's kind of hard to speak out against these programs. Everybody tries to keep their mouths shut, and to have a CEO of a publicly traded company that's being really transparent about it, I appreciate that. When he says that it will not reduce costs, does he mean because there will be errors and people will get even more sick and end up in the ER, and so the overall cost will be higher?
I don't know. I haven't spoken to Dan about it, so I can't. This was just a public quote. We got to get him on the show. This is just a public quote that we had. Yeah, we should get him on the show. I'll do that. But my guess is that's what he's referring to, because he says, the part of the quote said it'll necessitate the removal of any clinical oversight. So my guess is he's referring to the downstream costs, as you say, which is like, we may feel good that AI is treating and triaging and referring, right? But maybe the last mile things are lost.
This is someone who knows really well a digital care model and how much human interaction is necessary for positive clinical outcomes. And he is saying that this is actually going to increase costs.
Yeah, Dan, if you look at Hinge, and this again, all you can look at their history. They started off almost. They always had humans in the loop, but it was a very technology forward company. It's why their unit economics look so good. But they always had PT, physical therapists in the background, right? If something got elevated, and in truth, they've moved as they've moved beyond PT, to more of a center of excellence model and attacking other indications that are adjacent to MSK issues. They've continued to invest in their clinical labor force. So this, like you said, this is probably the most successful, most scaled company in our space. And the CEO has the guts to just raise the question: was this the right thing for care? And then I think on top of that, by the way, I do always worry about this, Halle. I love the value-based care movement. I've talked about this, and I love this model. I love government pushing innovation forward. I want that, and I think it's a real role model. And as we said, the health plans, who generally are slow to move, have followed really quickly upon the access program and copying the model. The challenge is, I genuinely think we consistently underfund this innovation, to your point. The innovation costs a lot of money up front. The J curve is very steep. And so even this model, where I understand they want to make it deflationary, but it might be right now, maybe just make it par. And then over time, as people get familiar with the models, and this happens on the economy all the time, right? You launch something at some price, and then over time, there's commoditization.
Yes.
So here it's not only is the payment model lower than fee for service, but then the model also withholds 50% of each monthly payment until outcomes are verified at the end of a 12-month period. And this is my problem with value-based care. You're who would fund that? You're essentially funding a lot of the cost to then get paid back maybe 12 or 18 months later.
Yeah.
That's a tough nut for, again, a thinly backed venture capital.
Maybe not so inclusive of startups then. That would be really challenging for most startups.
The good news is they're good news, and I talked to both Jacob Schiff, who's run this program, as well as they're going to be fully transparent with the outcomes. Okay. And so we're going to know within the next year. I think we're going to actually know within the next 6 months, which is great. And I'd love to see that. We'll talk about those outcomes when they come out.
That'll be fascinating. We'll talk about it in a few months then. All right, well, let's keep moving. Are you familiar with Character AI?
I am, yeah.
All right. So they are a consumer AI platform that lets users create and chat with these AI-generated characters, but I didn't know much about it. So I dug in. You can pick personas, celebrities, companions, and even therapists to talk to. And it launched just a few years ago, 2022, and it became one of the fastest growing consumer apps ever, particularly with teenagers, which we'll get to the importance of that in a minute. It was started by 2 Google engineers. They raised $150 million at a $1 billion valuation. And then they struck this licensing deal with Google, reportedly worth around $2.7 billion, which effectively took the founders back into Google and DeepMind. But they have had a lot of issues and lawsuits from parents saying that the platform has contributed to teen self-harm. But the story I wanted to share today is a recent lawsuit, which is the first of its kind. Pennsylvania and their Board of Medicine is suing Character AI over the unauthorized practice of medicine. A Character AI chatbot called Emily had been presenting itself as a life licensed psychiatrist. It even fabricated a license number, told users where it went to medical school, and the state of Pennsylvania found over 45,000 user interactions with this specific character.
That's crazy.
Crazy. Governor Shapiro said on social media, "I will not stand by as these AI companies try to take advantage of vulnerable Pennsylvanians and let the chatbots pose as licensed medical professionals. We're going to sue and hold them accountable." So the federal government effectively absent here. States are starting to act unilaterally, and Pennsylvania, they've already created this AI enforcement task force and an AI literacy toolkit for its residents, and also thinking about legislation that would require age verification for the AI apps. We have talked about this before, but a patchwork of state-by-state enforcement is going to create just real compliance complexity for everyone building in this space and not just the bad actors. But if you are running a state and you want to take care of your people and the federal government doesn't have its act together to do it at a national scale, what other option do you have?
So this is like, and again, I'm not a lawyer, and this.
Yeah,
this
we don't have our
strikes,
lawyer on.
Yeah, we don't have our lawyer on. We need him right now. Where's Michael? This strikes me as like this is an unusual case because it's AI platform. I know it that lets users create and chat with AI generated characters. Right.
But you can also choose characters that exist.
Right. So some user on Character AI created Emily, presumably. This chatbot?
I think, that's a good question. If it was originally created by someone or if it was just an existing one from...
Right, because I was trying to think this feels like, I don't know what the payment scheme is, but this feels like unlawful practice of medicine, right? And,
yes.
And actually, again, I hate to go back, but I hope all our listeners listen to Eric Larson podcast. Like one of the questions around AI is that he talked about, which I think is the question, and it is going to be the organization that assumes the liability is ultimately going to be a winner. But here, where does this liability fall? Because this is clearly unlawful practice of medicine. I'm not a lawyer, but my guess is that. And so that's not allowed. And it's regulated by state boards of medicine, as you noted. And Pennsylvania's called this to question. But I'm curious where the liability, I assume ultimately maybe Character AI, but if a user creates this fictional doctor, including the fictional license number was created, you said, where does the liability in that fall? I have no idea.
Yeah.
Is that the person who created, the user created, or?
You would think that Character AI has some sort of user, rules of using their platform where you're not allowed to make characters that would be breaking the law. I think it all comes back to Character AI.
By the way, this is just gonna continue to happen. Until the powerful institutions that are it's not just the government, but it's also the major players in our sector need to say, we actually want regulation. Because I've talked to these folks, health system CEOs, payer CEOs, and I say, listen, clinical AI is coming. It's here already, and it's coming for your organizations, and you got to think about that from your own labor pool and the hierarchy you have with doctors and nurses and care workers and all of the people you employ. But and some of them still look at me like I'm this kooky venture capital guy, even though I don't wear a wearable, right? But this is a great example. The consumer wants this. There's clear demand for mental health. We know there's a shortage. And so, in that void of, a lack of providers from the traditional institution,
totally,
in the void of regulation, which I think our industry needs to call for, this is going to continue to propagate itself. Character AI is just one example, but there's going to be many. And I don't know what we're doing. It's
totally.
Just the stakes are too high.
The stakes are too high. I just want to acknowledge last thing about this story is that, again, this is a case where clearly there are unmet needs in the market. It is very hard to find a therapist. It is expensive. It is often out of network. A lot of therapists don't even take insurance. I have a friend whose husband is a veteran, and he was saying they cannot keep therapists at the VA long enough. So he builds that trust and then they leave and it's someone else. And so it's just been impossible for him to find steady therapy. We obviously have not well-served people in healthcare for helping them manage their mental health. So we should not be surprised that people are going to these chatbots for answers and for support and for help. that really shouldn't be a surprise.
No,
but now it's our time to make sure that they're doing it safely within the law. But I do think that I would actually love it if there was a digital twin of my therapist who's $400 an hour, who I see once a month.
And with you 24/7.
And with me 24/7.
Yeah.
I'd love to, like, what would Dr. I'm not going to say his name here, do? App. Like, I truly think that there are answers here that
so
AI
much better
can
for the
help
patient.
make it
So much better for the patient.
more accessible.
By the
This
way,
is obviously not it.
We're lucky to be investors in Waymo, and like that company is a totally different use case of AI, but like they're getting regulated. They have to go through massive, and by the way, if you've ever driven one, it's amazing, and it's going to get better every day. It's unbelievable. They have to go through umpteen numbers of regulations, and rightfully so, to drive in the streets of every state. And yet here we're sort of operating blindly, and no pun intended. And it's like, in an industry where the stakes are equally as high. What are we doing?
Totally.
All right. Well,
Okay.
Actually, I think we are going to talk a little bit more about AI, but I guess that just is everything's AI now, because, Rock Health, they devoted an entire week's news column to this topic, which is they called the $2 trillion question, what impact is AI going to have on drug discovery and drug development? And I'm really excited about the raw potential for this. To me, of all use cases in the world, I think is where AI could make the biggest impact for human lifespan. Like, I literally think this is when and Dario of Anthropic wrote Machines of Loving Grace and devoted most of the paper to the potential here. So just from the past few weeks, the deal flow has been immense and generally remarkable. Isomorphic Labs, which is a spin out of Google DeepMind, closed a $2.1 billion round with a bunch of leading venture capitalists, sovereign wealth funds participating. That company has partnerships. What?
Non-biotech investors.
Non-biotech investors. Lots of interest from tech investors in this space because of the potential. Isomorphic has partnerships with major drug development companies, Novartis, Eli Lilly, Johnson & Johnson. These are real players that are really looking to the potential of this technology to improve the productivity of their pipelines and the development processes. There's been a bunch of other companies, which we won't necessarily reference, but billions and billions of dollars have flown in over the last, couple months into the potential here. And, the FDA is actually acting to announce the first time ever a real-time clinical trial review pilot with AstraZeneca and Amgen, where regulators can now review safety signals and clinical endpoints in the cloud, like in real time as they occur, which only you could do with AI, rather than waiting for trial completion. And the FDA's own chief AI officer said that this could compress overall trial duration, which is that's the big, from a DCF, a discounted cash flow perspective, a huge cost is the time. And they think they can cut it in half, potentially. So lots of exciting things. There's 173 AI-originated drug programs in clinical development, none of which yet have gotten approval, but there's lots of promise. And, even Anthropic recently appointed the Novartis CEO to their board. So you could tell that the big foundational model companies are taking this seriously, too. I think the question that I have is, a lot of these companies are on the discovery side right now, which means they're trying to identify either new undruggable targets or unknown targets, and either combine that with an existing, molecule or therapy, or more importantly, finding new therapies or modalities that might actually hit that target and lead to clinical effect. But they're at the very early phase of the drug development process, which generally is not the most expensive phase. The most expensive phase is actually running the trials and then, selecting the cohorts. And ultimately, biology still is biology. Does the safety signals read out positively, and do the efficacy signals read out positively? And that's where the bulk of that time and that cost occurs. A lot of these companies that are funded by these venture capitalists at very large valuations, I believe Isomorphic's valuation was $10 billion, which for a preclinical, right, a discovery company is astronomical. And my question ultimately, when I think about this, is ultimately, are these companies going to have to pivot into becoming drug development companies themselves, right? Are they going to have to ultimately become labs, run the trials at the valuations that they're raising at? I think that's the question. So to me, it's not a question of if it's just a question of how and how much and at what
and it
value.
Sounds like there's kind of a gulf or a dearth of investors kind of in that space in between. Like the tech investors are excited at this early stage, but then like who's going to actually fund the expensive piece of it?
For sure, there's more tech investors coming to biotech, which is great.
Yeah.
The question is, how are they thinking about, the amount of funding that's going to have to go towards this? How are they thinking about the time?
The drug development timeline and how much can it really be? There was an article in Stat News, which was a interview with Peyton Greenside, who's the CEO of Big Hat Bioscience. And she said, AI in drug development, it's powerful, but it's overhyped. And she doesn't believe that it compresses the full drug development timeline the way that the hype of AI suggests. Obviously, time will tell, right? We'll find out.
My sort of like just go nuts, like let's dream a little bit scenario for this is that taken to its fullest extent, I've been thinking about this because I've been thinking about this dichotomy. There is a world now, the way you could compress the timeline, which is often regulatory defined, is if AI was good enough to ingest all of your data, Halle, all of your data, right? And mash it against, real data in the world and from different drugs. If you had, God forbid, a condition, could we develop a drug that is literally just for Halle? Right. Mm-hmm. And so Halle is the only clinical trial participant. She consents into that.
Personalized, yeah.
She consents into that. And so therefore the cost and the drug development timeline is decreased. I was talking actually on one of these baseball trips with a buddy of mine who runs a major biotech company. And I put this forward to him and he said, yeah, Steve, I think that is possible. Then the question is the manufacturing cost. What does it cost to produce a drug that just works for Halle?
Again, AI is like totally reworking manufacturing at the same time. So
I think this like zero shot, really personalized medicine could be the way that you get by the cost and the time of drug
maybe
development.
The rare disease community. Fascinating. All right. Well, on that note, let's talk about the regulatory agency that has to validate every single one of those drugs, the FDA, which continues to be a big hot mess. Marty Makary has resigned as the FDA commissioner after just over a year in the role. His breaking point was the concern over the FDA's approval of fruit-flavored e-cigarettes. We're back talking about Juul, I guess.
Oh my God. But we talked about this like 3 years ago.
I know, and it's back. And we had outlawed these fruit-flavored e-cigs because public health research shows that they appeal to young people and increase the chance that young people who would not otherwise smoke use vaping as their gatekeeper to nicotine. And so Makary didn't want to approve it. Trump pressured him to approve it. And that seems to be kind of the breaking point. Despite that, he has had a controversial tenure at the FDA. And frankly, he was caught between a lot of very different interests. And something that I think everyone can kind of agree on is that he was really an independent thinker. He really stuck to his own convictions on issues. But public health advocates, they were always frustrated by what they viewed as him being too soft on vaccines and public health oversight, while abortion policy became another flashpoint. He had criticisms on both sides over the FDA's handling of mifepristone. Meanwhile, Maha was frustrated that he wasn't moving aggressively enough on things like food additives and ultra-processed foods. And biotech and pharma world also had mixed feelings. Some people appreciated that he talked openly about speeding up approvals.
We just talked about that,
Yep. And modernizing things. But, others worried that there's just so much growing unpredictability at the FDA, especially under his tenure. What's interesting is that he came in with a lot of credibility in healthcare. He's a Hopkins surgeon. He wrote a great book about healthcare costs and transparency. He really built this reputation as someone who could be an independent-minded reformer versus an insider. But I think it really just highlights how impossible the FDA job is becoming because we've just completely politicized healthcare. Every single FDA decision has really come down to being something that's a political or cultural debate. We can't just look at the data and the science anymore. And because of that, we've lost a ton of career scientists at the FDA. There's been so much turmoil. And it's really disappointing to see because our industry really depends on the FDA to be stable and predictable.
Yeah. Well, I have to just make this point of irony. Maha means make America healthy again, right? What do we think Zeke Emanuel would think about flavored cigarettes? Is that in the 6 things that you should do? I mean, come on, what are we doing? Yeah. So anyways,
whole rolling back EPA stuff. And
it's just very inconsistent. It feels very whimsical how we make policy. And I think, again, this is to just, it doesn't feel like we have a central organized strategy around healthcare. And that's really challenging in an industry where we have long timelines and lots of uncertainty and lives are at stake. And so, we talked at the beginning of the podcast about how healthcare is driving all the jobs in our economy, right?
Yeah.
And presumably we talked about where healthcare could be one of the greatest unlocks with AI to improve human lifespan. And yet we're cutting and so much potential, right? And yet we're cutting research budgets through the NIH. Like lots of universities that were leading centers of innovation are like basically running at a massive deficit and are, we're preventing foreign workers, foreign intellects to come back into our society who actually, if you look a lot of the biotech, there's obviously a lot of more American-born researchers, but there's a lot of international-born researchers in the labs at MIT and Stanford and Johns Hopkins.
Yep.
That's all been decimated. And then we have an agency which is responsible for like trying to create a regulatory framework that you can follow. Is totally topsy-turvy right now in a time when the whole world is topsy-turvy, put aside the macro geopolitical issues, but just with AI, right? Like it's very dynamic times. And so I think the one thing we need is a stable FDA. I'm hopeful that, frankly, I think the administration's realized that there's been a lot of uncertainty and chaos in the RFK Jr. led HHS. I know Chris Klomp. We had him on the podcast. He's now been charged with trying to help make this decision. I'm hopeful that reasoning, smart minds will prevail here. That may have been the reason that Macri was pushed aside and try to pick. This is going to be an important pick. And we're going to know in the next, couple months who it is. Because I know my friends who invest in biotech, it's like they're just kind of almost besides themselves. They need to have some predictability in this agency. So let's hope for a good pick here.
All right. Well, what a month we had, Steve. It was good to see you as always.
You too. I'll be trying to wear a wearable at some point.
Yes. Next time I see you, we all want to know which wearable you picked.
Okay.
And to our listeners, thank you so much for joining us. Next week, we actually have a conversation. You mentioned Waymo, Steve. We have an episode called What Healthcare Can Learn from Waymo. Someone who sold their company to Waymo and then started a healthcare company. I'll let you guess who that is. But wishing everybody a good month.
Yeah. Happy June.